Let's get you inputs from the state of Gujarat, which continues to be one of the worst affected states right after Maharashtra, with a huge number of cases reported on a day-to-day basis. Well, at the moment, what we are getting to hear is that the overall cases have exceeded the 8,000 mark. The current figure of total number of people infected in Gujarat stands at 8,542, but 6,086 out of this figure comes from Ahmedabad alone, which is why Ahmedabad remains a problem area despite very strict measures taken by the authorities. Remember, only milk and medicine shops are allowed to operate in Ahmedabad. Despite a severe lockdown restriction, the city continues to report more cases. On Monday alone, Ahmedabad reported 268 new cases, including 19 deaths. With the rising number of coronavirus cases, the civic body has now announced a new step of banning cash on delivery. So COD will no longer be available as an option for grocery and food items after 15th of May. This is being done again to curb the spread of the virus through currency notes. My colleague Disha is tracking the state of Gujarat for us. So Disha, first a quick update on the figures, if you can put it in context for us. The individual day spike that we are looking at in Ahmedabad is quite alarming. Now, given the fact that there were such strong measures imposed, despite that, the numbers are on the rise. And tell us more about the new steps that have now been announced to further contain the spread.
Well, definitely at this point in time, Afrida, the numbers that we are looking at yesterday itself, specifically in this city of Ahmedabad, we saw over and above 280 cases being reported. The positive ones, of course, that I'm here talking about, taking total tally to over 6,000 positive cases in the city of Ahmedabad alone. And that's the city which contributes 80% to the overall positive cases in the state, because Gujarat's positive cases have gone ahead 8,500. So you are looking at that how Ahmedabad's situation remains to be grim. And keeping this in mind, couple of measures that of course the administration is taking at this point in time. Firstly, to ramp up the contact tracing and also to increase the bed capacity across. So at this point in time, what they claim that they have on an average 2,000 to 3,000 beds across the city in most of the hospitals as well as the centers, but that they plan to increase further by adding 10,000 more, so taking at least to 12,000 mark, keeping in mind how the cases are increasing each and every day. That is one. Second, of course, like you rightly pointed out, yesterday itself, the government announced that how they will ban completely cash on delivery option for people who have been ordering online, or for people who have been ordering online groceries after 15th of May. Because remember, till 15th of May, Ahmedabad is a city which is under complete lockdown. So even post that, at least cash on delivery will be something which won't be allowed, because the administration feels they do not want to have a lot of contact between two people, anyhow. And thirdly, of course, Afri, the last point, they are also identifying the super spreaders in the city, because remember, super spreaders are the ones who infect over and about 10 people at once. So they are mostly the vegetable vendors, garbage collectors, shop vendors. So 331 super spreaders have already been identified in the city of Ahmedabad, and now the biggest challenge is to identify the high risk contacts.
If I can come to you on the point of super spreader in just a bit, Disha, just stay with me. I will just put out the information with regards to super spreaders, and I just come back to you on that point separately. 131 super spreaders have been identified in Gujarat's Vadodara alone, making it the third worst hit city after Ahmedabad and Surat. So super spreaders are infectious disease carriers who have infected a large number of people. The idea is to quickly identify these super spreaders so that there can be strict containment measures taken. The administration plans to identify 5 lakh high-risk people, especially those who are above 65 years, and advise them home isolation from 1st of June to 31st of July. Vadodara has in fact already conducted 6,500 tests and screened 8,262 people so far. Disha, sorry I interrupted you. I just wanted you to dwell a little bit on the point about how they are going to identify and isolate the so-called high-risk people. And is this a measure taken to, in a way, allow the rest of the people to operate normally, because otherwise there is no way that a state like Gujarat or Ahmedabad can open up with such a high, a proliferation of cases as we have noted today.
Well, absolutely, Afrida, because let's not forget that after Maharashtra, Gujarat is the second most affected state across the country if you talk about, with high number of positive cases. So keeping this in mind, Ahmedabad, Surat and Vadodara in Gujarat remains to be the worst affected areas. And like firstly you pointed out about Vadodara, they have also started identifying the super spreaders, because this way, of course, they believe that they will be able to get hold of large number of people who might be infected with this virus. So 131 super spreaders have been identified in Vadodara alone, is what we understand, out of 8,000 people that they have screened so far. And the massive challenge again remains to identify the high risk contacts and direct contacts of these super spreaders, which the administration is doing at this point. Secondly, the government, of course, has observed that in the last 2 months, whatever deaths or positive cases are coming to light, those are mostly from the age group of about 60 years of old. So those are the vulnerable high risk category people. And as per their survey, 5 lakh people are such that are above 65 years of age, specifically in the city of Vadodara. So what they plan is, in the next 10 to 15 days, they plan to identify all 5 lakh high risk category people, and they will advise them to stay home under isolation. If at all, if they stay in slums, then they will be institutionally quarantined, because their social distancing absolutely not possible. So this is how they want to contain the spread of this entire virus. They believe that about 60 years senior citizens are the most vulnerable age group, and that is why it is important to do this.
Right. The idea is to seal and contain those who are vulnerable and those who can be spreaders and a danger to the rest of the public. And then, of course, think about opening up. Right now, that looks like a distant possibility in a city like Ahmedabad or Vadodara or Surat for that matter. Thanks for joining us, Disha, with your inputs on the story.